So I'd like to just quickly share my experience with COVID. I had it sometime during the second wave, and it was a very stressful time. I developed mild symptoms, didn't need to be hospitalized. It was generally general muscle aches, pains, and joint pains, and very lethargic. So my main issue was the fear. It creates a certain level of fear in you when you do have COVID, and that fear is something that was unprecedented. It was something I never imagined would even suffice. So I was mostly nursing the fear, the anxiety, more than I was nursing my actual symptoms. That is how this COVID had affected me psychologically and physically. And for me, the psychological part of it was the bigger challenge than the physical aspect of it. And not downplaying the physical aspect, because it caused a real danger. Death is a real concern, which was a big concern on my side. Am I going to survive this? Am I going to come out of this thing fine? Am I going to come out of this thing alive? Am I going to end up on a ventilator? Am I going to end up not shortage of bed, being that patient that they have no beds for? So it's a real concern. It's a real fear. And even if you have the mild symptoms, it does affect you psychologically, and it create a certain level of fear in you. So to avoid all of that, adhere to COVID regulations. The first case, as you know, it came last year, 2020, at around March, which was imported. And then the cases just started to develop and to grow, which was generally our first wave. We were obviously unprepared. The whole world was unprepared. We were all trying to figure out how to tackle this virus and this pandemic the best way we can. And given that we live on the African continent, our resources, our infrastructure, it's not on the same level as, let's say, in other first world countries. So, as you know, the private sector, public sector, it has different resources, there's different infrastructure from both aspects, but we managed to work together as a team and to try and combat this virus. So the first wave, somehow we managed to contain it and go forward and managed to work around that first wave. Then the second wave came. It was unprecedented. Most people in general were assuming that the second wave would come during flu season. And in South Africa, unfortunately, it came before that, which was around summertime in December. So that was not in keeping with most people's assumptions and predictions. But in the Northern Hemisphere, where the winter season was already there, they had already, according to their understanding, their second wave was already started, and our second wave somehow coincided with their second wave. So with that one, it was very problematic. We had run out of beds. We had a very big issue with beds, with ICU, with ventilators. So it was a very stressful time in this country with regards to combating this virus. So with this third wave that is coming, apparently it's going to be in the next 2 or 3 months. So it's not a matter of if it's coming, it's a matter of when it comes. So this will be the third time around that we are trying to combat this virus. And hopefully we will be able to manage it better than the last time around. Not saying that we failed, but we had a couple of challenges with the second wave. With regards to keeping healthy, staying healthy, maintaining a healthy lifestyle, and adhering to COVID regulations, that is the most important. We've all heard about COVID regulations since March 2020. We hear about it in the news, on the television. You need to social distance, you need to stay in the house, don't be engaging in unnecessary crowded spaces. Try as much as you can to work from home if possible. And when you are engaging with people, you must please keep the masks on. You need to wash your hands, you need to maintain social distance. So those are very important measures. And funny enough, those measures really work. So if you do adhere to those COVID regulations and those COVID measures, you should be able to protect yourself and also to protect your family and those loved ones around you.